A 46-year-old woman has 2 months of worsening shortness of breath on exertion. Her oxygen saturation is 91% at rest and drops to 84% after walking just 200 feet. Her echo shows a normal left ventricular ejection fraction, but the pulmonary artery systolic pressure is 40. Right heart cath reveals pulmonary capillary wedge pressure of 28 and a mean pulmonary artery pressure of 36. So what is the most likely cause of her symptoms? A, methamphetamine use. That would raise the pulmonary artery pressure, but it would have a normal wedge pressure. B is heart failure with preserved ejection fraction. It is possible. And then we have C, obstructive sleep apnea. This also would raise the pulmonary artery pressure, but would have a normal wedge pressure, so it's not going to be that. And then D, chronic thromboembolic disease. Again, we would have a normal wedge pressure here. Let's go over the reasoning. A mean pulmonary artery pressure over 20 is going to indicate pulmonary hypertension. If the wedge pressure is above 15, it is pulmonary venous hypertension, meaning the problem is on the left side of the heart. Remember that the wedge pressure is going to reflect the pressure in the pulmonary veins and indirectly the left atrium because there's no valve between the two. Since the patient's ejection fraction is normal, this is going to point to a diastolic dysfunction. That's going to be heart failure with preserved ejection fraction. So the correct answer is B, heart failure with preserved ejection fraction. And this is the most common cause of pulmonary venous hypertension.